Dr. Jean Molinary, thank you so much for coming out to the 2019 GOMA Fall Conference. You talked about diabetes and heart disease and
Correct.
the sweetheart. Tell us a little bit about your practice, if you don't mind.
Sure. I have a practice in Marietta. I've been there for about 23 years. Our group is associated with WellStar, with 6 other endocrinologists in our group. We see a little bit of everything. About half of what we see is typically diabetes.
Sure. And there's a few medicines that certainly help prevent heart disease that you mentioned.
Correct.
Where do you, if someone's thinking, I want to reduce the risk of my diabetic from having a heart attack or a stroke, where do you see one versus another? Is there one that you kind of go to, or is it just depend on the situation?
Well, we try and individualize our therapy for the patients,
Sure.
depending on where their A1C is, their age, their other risk factors, what other medications that they're on. But typically the group of medications that we like to use are the GLP-1s. We find that they're very effective. The risk for lowering cardiovascular disease appears to be proven, and they're typically easy medications to take. A lot of them are once weekly now. They're also coming out with an oral GLP-1.
Oh, really?
So there's a lot of advances in diabetes for sure.
And of course, prior authorizations is the real challenge for us. And
Correct.
those, they want us to just put them on a sulfonylurea or something like that.
Right.
Is talking about the heart disease prevention, is that a way to get over that hurdle with these insurers, or they don't seem to pay attention to that?
Right. You always have to, push for the patient. You always have to express, what has the patient already had? Has the patient already had an MI, a stroke? Do they have hyperlipidemia, hypertension, obesity, other factors that can contribute to heart disease? Have they had any studies that have shown increased risk? Stress tests, CT calcium scoring, all those are important factors to try and get insurance
So
to
kind of
pay
making
for
your
it.
case in front of the judge, so to
Right,
speak. Yeah.
right, exactly.
Well, once again, thank you so much for coming out and
Sure,
speaking
my
today.
pleasure.